The South African Medical Technology Industry Association is urging government to address delays in payments to medical technology suppliers by provincial health departments. SAMED says some departments, particularly in Gauteng and KwaZulu-Natal, are facing budget shortfalls resulting in paused or delayed purchases of essential medical items. The association says these delays are negatively affecting patient care and health outcomes as they lead to late diagnoses and interrupted treatments. Now, Tanya Vogt is the CEO of the South African Medical Technology Industry Association and joins us now via our videolink. Tanya, thanks for your time and your patience. Welcome to the SABC News Channel. You know, typically the work that SAMED's members do is crucial but unheard and not necessarily spoken of. So let's begin with much needed context as you explain to us what kind of services you typically supply to these government departments.
Great, thank you, Ayanda, and good morning to the viewers. So SAMED is a voluntary not-for-gain trade association, and we have 147 member companies. These include multinational companies, distributors, local manufacturers and wholesalers of medical technology. And I like to describe medical technology as anything that's in a healthcare setting or a hospital other than the people and the wards.
That's crucial. So we're talking perhaps ventilators, things to do with equipment that might be carried out in operations, for example, etc., etc. And I only ask that question because it helps us better understand the urgency of this issue. According to your statement, 1 billion rands worth of payments are outstanding. That must make it incredibly difficult for you to get supplies of this equipment so that you can continue providing these services.
Absolutely, and I just want to reiterate that half of that 1 billion is actually outstanding for more than 120 days. And the situation has really reached a tipping point. If I may, I'd like to share with you just how this is impacting one of our members who happens to be an SME. Non-payment by the Department of Health has severely impacted our cash flow. We are unable to service our creditors or meet our monthly expenses. As an SMME with limited resources, we have been under immense financial strain. My business was debt-free until 8 months ago, when I had to approach the bank for a 1.5 million rand overdraft, costing me 19,000 rand a month in interest.
Sure.
Most of our products are imported, and without sufficient funds, we're unable to fulfill orders. And if this company doesn't receive payment by the end of this month, they'll be forced to close their business and lay off 20 staff members.
Sure. Really difficult to hear that, and sadly such a familiar kind of crisis that is faced by many suppliers to government. We'll speak about the extent to which you've received any response from the state, but I also know there's a MedTech master plan in place which was aimed at improving localization in the procurement of these supplies. I don't imagine this issue is helping reach that objective.
Absolutely not. And in fact, we are engaging with the leadership at the MedTech Master Plan. And just this week, SAMED wrote to the Ministers of Health, Trade, Industry and Competition, as well as Finance. And we are requesting their urgent intervention to resolve the matter. Some of our members have had to stop supply. Others have, in fact, are no longer even supplying the public sector at all. So they've withdrawn their businesses totally from the public sector. And we know of a circular by the KwaZulu-Natal Department of Health that has actually said that only emergency procedures are being allowed because essentially they have run out of budget. So the challenge is that they're using next year's budget to pay for last year's debt. And the SAMED members can no longer afford to bankroll the provincial departments of health.
What is also important, of course, is that there's a heated debate taking place currently about having a national health insurance that is meant to universalize public health care. I beg your pardon, that's meant to universalize healthcare generally speaking. And again, you know, you hear instances like what's taking place with some of your members, and you wonder that there's such a journey still to be walked in ensuring that there is a standardization across both the private and the public healthcare sector, so that, you know, those who provide these crucial items can continue doing so?
Absolutely. You know, I think under a national health insurance system, what we're hoping to see maybe are significant changes, improvements, perhaps in the procurement systems, but in speedy payment of suppliers. Suppliers continue to provide products to government. We are deeply committed to patient care, but ultimately when your business can no longer function, you have to do something serious, either exit the sector or retrench staff or even close your doors. So I think for us, what we're asking now is that interventions at the highest level be undertaken, that the ministers and the NECs actively engage with us and our members to ensure that this long-standing debt issue is addressed promptly.
Of course. And has there been any response to your requests, Tanya?
So we have engaged with various levels of government for a number of months, I could say years, but to be frank, there seems to be little appetite to resolve the issue, and in our view, there's no sense of urgency. So, you know, this is why I'm here today. We're calling, as I said, on the leadership at the highest levels to please heed our call, meet with us, engage our members, and find solutions.
Absolutely, and hopefully from your lips to their ears after this interview. Tanya Vogt, thanks very much indeed for speaking to us. That's the time we have, at least for this moment, but an absolutely important story this. Tanya is the CEO of the South African Medical Technology Industry Association.